તમે એ સૂટ લેવા જાઓ ને એ દિવસે 4,000 ડિપોઝિટ લે.
Yeah, very good evening to each and everyone. Welcome to ADC webinars. This is 157th webinar to be conducted by Dr. Sanchit Paul, the only one exclusive or very rare exclusive pediatric practice as Tooth Tales in Delhi, NCR. So webinar is digital happy gas in digital dentistry. High time to eliminate our own hesitation. So it's an interesting title, and definitely the webinar will be interesting. I have attended Dr. Sanchit Paul many times. He's a very nice speaker. Let's hear out from him and welcome Dr. Nikita, welcome Dr. Kuldeep, Dr. Varsha, Dr. Sakshi, and our beloved sir, Dr. Gurkirat sir. So let's start. Over to you, sir, Dr. Sanchit.
Yeah. Thank you, Dr. Sudhir, for such a nice and warm welcome, especially in Delhi winters. It was incredibly warm. Allow me to share the presentation once, and then I would begin. In the meanwhile, very warm good evening to everyone. It's a Sunday evening, especially in Delhi NCR. It's pretty cold and chilly, but good to have people joining in. A very, very warm regards to our teacher and guru and mentor, Gurkirat sir, to be here. It's always a delight and a pleasure and a bit of nervousness to speak in front of your teachers. But then it's great to share the knowledge and learn from everyone. I'm about to start my presentation. Let me share it over there. Yeah. Just let me know if I'm audible enough and my video is good enough. What is it? Am I good enough to be listened?
You're audible, but video or screen is not there, or slide is not there. But we are audible. You are audible.
Okay, I am already screening my
Okay.
sharing my screen.
Yeah, fine.
Can you see the screen now?
I have given authority to share the screen to multiple participants. Once again, I will do it.
No, I am already sharing the screen, and
yeah, now you see.
Let me
Screen
try
is
that.
there. You are there on the screen. Slide
Okay.
is changing.
Is it
And
now?
now your webinar is there.
Yeah, you can see the screen now?
Yes, sir.
Yeah,
You
okay.
can
Thank
do
you.
full screen. Yeah, perfect.
Okay, so very warm good evening once again. I wish you a very, very happy new year to each one of you. It's a great number when Dr. Sudhir mentioned 157, because I remember, I think probably if I don't remember, so it's mentioned 2017, but I do remember in COVID times, we all listened to a lot of
Yes.
ADC webinars. I think this is my second webinar in
Yes,
ADC.
sir. Yes.
So it's great to run such a marathon series. I'm sure few more, and probably you'll be in the Limca Book of Records or Guinness Book of World Records.
No.
So great to be here.
Yeah.
I'm not going to take too much time. We're gonna so it's not a lecture, detailed session on a lot of things. It's a little quick bit about the happy gas, or we call as nitrous oxide. Since we are talking about AI and digital era, we're gonna briefly touch about the digital happy gas part of it. So to begin with, so this session is roughly around 45 to 50 minutes. I'll try to keep it less of theoretical and more of clinical and video based. So I hope you have some takeaways, messages, and have some good time getting the information. So to begin with, whenever we talk about, so since I'm an exclusive children dentist, I only deal with children. When I tell with children 0 to 18, you would see most of the content which is related to children. But again, the gas or the nitrous oxide is not only for children. It's for everyone who has some form of anxiety and fear. But to begin with, whenever we see a child in the clinic, we wish the children look something like this. So this is our wish. Every day we want that the children should be handled such a way. But the reality is we hear the different type of music. All of us who have dealt with children in our practices, in our departments, we know, we are very familiar about this. So how does it affect us in general? So it's a very interesting article which mentions that most of us who practice specialty actually suffer from the same disease related to it. As you mentioned, as you can see, a cardiologist may end up with the more of hypertension, chest pain, and palpitations. Similarly, a neurologist may have their own neurological issues. Similarly, as a pediatric dentist, we end up with a lot of fatigue, exhaustion, and tiredness and burnout, because we are dealing with those children every day. Now, we all have been seeing other way of managing children, which is known as physical restraint. Now, this actually leads something called fearful child, and I very importantly say fearful adult, because whatever behaviors, whatever experiences we face as a child, we actually carry it over to the adulthood. Then very, very importantly, we end up with some substandard or inadequate pediatric dentistry. There's a vicious cycle of repeated restoration. We all have seen filling की थी, filling निकल गई, parents बार-बार आ रहे हैं, the child is getting tired. So there's a lack of trust and understanding between the parents. So it's important to understand that this is not the ideal way to do children dentistry, just because we feel this is one way to be done over here. So there are a lot of scientific articles. I don't want to go much detail into it, which highlights that protective stabilization or restraint has had negative outcome, not only to the children, but to the parents. And they were not very comfortable in the accepting of that behavior guidance. Now, again, there's a lot of articles which highlight that there's a reciprocal longitudinal relationship between a fear among the children and the oral health. So the more you are fearful, the bad oral health you have in the children. So higher dental fear, lower oral health. That's how it works. And there have been both 10-year, 15-year, 25-year studies, something called oral health related quality of life. So what are we dealing with? So in textbooks, we have all read something called fear, anxiety, and phobia. And probably we know the definitions of it. But in clinical situations, it's usually indistinguishable. Because when the child comes to you and is not able to sit on the chair, accept instructions, that time the textbook definition doesn't really help. But just for a clarity purpose, fear is something usually which is or because of a particular stimulus in the form of इंजेक्शन से डर है या मशीन से डर है या फिर एक चेयर से डर है. Whereas an anxiety is generalized. Just to keep the things in perspective, it is almost like fear is I don't want to go on a ride because I'm fearful of rides. Whereas anxiety is I don't want to go on a plane because every plane can crash. So it's a generalized anxiety. So fear can be taken care by some counseling or by some guidance. Anxiety really can't, because even if you remove that stimulus, कि चलो machine नहीं लगाएंगे या injection नहीं लगाएंगे, anxiety remains. Most of the times it's the anxiety which is most difficult to manage rather than the particular fear. Now again, little bit of detailing about fear. Most of the fears are acquired, maybe subjective in the form of किसी से सुन लिया, किसी से बताया, parents ने बोल दिया injection लगाते हैं, doctor and all. Most of the children also in India have objective fear because all the vaccinations have been done without proper conditioning. So without proper management. So वो फिर एक conditioning हुई है कि हाँ injection मतलब doctor. We call it conditioning fearing. But then there is also something called innate fear that despite the child doesn't have any previous experience, their personality is that the child is fearful. Now the reason I'm telling all this is because in a clinical situation, it is very difficult to find it out what is causing this fear or anxiety and how to manage it if you are as a pediatric dentist or as a dentist want to treat it. So in our textbooks and probably in our regular education, we know a bit about communicative behavior guidance in the form of tell, show, do, audio-visual aids. Am I audible now? Yeah, somebody has to just
Yes,
tell.
you are audible.
Yeah. Actually, I think somebody muted in between.
Yeah,
it's okay. So, so I don't want to go in again in details, but in general, we know about modeling, desensitization. हम सब ने अपनी textbooks में पढ़ा हुआ है audio distraction, but we understand that these basic behavior management techniques may work in certain areas, but majorly may not work in the children who have these different type of fears and anxiety. And that's why the funnel goes on the right side, where we have to use the green zone and the yellow zone when blue doesn't work in the form of nitrous oxide sedation, apart from some stabilization or sedation or general anesthesia. Now that's bringing us to the topic of digital happy gas in the digital dentistry. Everything is going digital in the form of records, in the form of scanning, in the form of radiographs. It's important to now talk about happy gas in the digital way. So we'll go through it. It's a little brief about me. We'll come back to this at the end of the session. So I'm not going to take a elaborate lecture on sedation dentistry. To be very honest, this is such an elaborate topic that even 3 days, 4 days, 7 days workshop or a conference is insufficient because it's a proper elaborate science. But what we're going to try to do is try to give you a little glimpse on how does it work what exactly nitrous oxide is and how clinically it can really benefit to each one of us. So the videos we will be showing, they are not scripted. They are all real. They are non-fictional, and we have tried to show you the transformation, which would help you to understand how does it work. So let's begin. Quickly, why we are talking about sedation, since we have the background, because the idea is to provide uncompromised quality care. And I wish to really highlight on this because that is one motive we need to do. Just because बच्चे हैं, just because दूध के दांत हैं, just because मिल्क टीथ हैं, निकल जाएंगे, doesn't mean we do inferior work. It really doesn't help in long term. And then we see a lot of challenges over the period of time where this has led to more dental problems over the period of primary dentition or mixed dentition only. Then secondly, we obviously have to minimize the disruptive behavior. वो पकड़ के जबरदस्ती restrain वाला behavior doesn't help, and the child should not have this thing कि अच्छा dentist के पास गए तो वो फिर negative experience ही होना है. So to promote the positive psychological response is again important. Patient welfare and safety. Somebody can get hurt. The injections can get thing. We all know about biting and pricking. So again, all these things works in a practice where the sedation is not being done. And most importantly, we want a society where the people don't hate dentists. Now, most of us who have been told, even as adult dentists, yeah, I hate dentists, this is coming from the background because they always perceive dentistry as painful, something which is not comfortable. And that's where the sedation completely changes the perspective. So again, we know about all these roots with the parental and enteral, but majorly we're going to focus today on inhalation. That is our topic of interest for today. And in inhalation sedation, again, I can go on detailed history, but I want to touch base on the most important things that Dr. Horace Wells, actually the entire history of anesthesia started from nitrous oxide. In case we are not aware about it, we probably have forgot about it. And he himself used this gas in the era for the extraction of his own tooth in a stage theater. It's a very amazing history. I wish I can elaborate it in detail, but on a brief note, he performed the procedure of extraction of his own tooth in front of everyone to demonstrate that how the gas really. Can we have the muting from the participants, please? Yeah, thank you. So that's why later on in 1870, he was considered as the father of anesthesia, Horace Wells. So very interesting. If any time somebody says ki nitrous oxide kya hai, kab hai, kaise hai, which usually comes in the picture, please do tell them that the entire anesthesia started from nitrous oxide, and that's how old the gas is. This is again interesting snippet I picked up, which mentions, if you can read the tagline or the caption, they're showing chemistry, no mystery. In 1839, the laughing gas was mentioned in the ancient scriptures, and this is in Boston, Howard Medical Institute. So that is how we are looking at almost 200-year-old history. So this is an ad of a party where nitrous oxide gas is being used as a what we call as a euphoric agent. It's mentioned laugh, sing, dance, speak of it. So the idea to show these is to let you know that this is not something new. It's been there. It's 15th April 1845. Again, almost 180 years we're talking. So these are all snippets. Very interesting ad by a dentist. I probably don't see this now, not in Delhi NCR at least much, or maybe all over the country, that in 1882, June 30, Dr. Buchanan is the only dentist in the hills that extracts of his teeth without pain by the use of nitrous oxide gas. Again, the idea to highlight how old it has been, how vintage it has been, how safe it has been, and how it was advertised to use it in our practices. Something happened in between, and we are not using it, especially in our country. Otherwise, it's a worldwide phenomena. Whoever has traveled abroad, nationally and internationally, they know what I'm talking about. Okay, so we can talk about what is nitrous oxide exactly. So basically, it's a non-inflammable, non-irritating, colorless gas with a very, very faint sweet taste and odor, which is actually in favor because the children like it, especially. Same for the adults. And it's a very effective analgesic, anxiolytic agent, mainly causing some form of serious depression and euphoria with very, very minimal effect on the respiratory system. Again, we can go a little bit on technical in the form of how does it work in the body. It has very, very rapid uptake. So clinically, I can give you snippets. It can work as early as less than your Maggi noodles cooking. Maybe Maggi noodles say 2 minutes noodles, but वो 2 minutes नहीं होते हैं क्योंकि पानी भी नहीं उबलता 2 मिनट में. It takes at least 5 to 7 minutes. It's faster or probably equivalent to a Maggi noodle in the form of rapid uptake, absorbed quickly from the alveoli of the lungs. And since it doesn't... Okay, can we have muting from the participants? Okay, thank you. Since it is insoluble in any other tissue, it quickly gets excreted from the lungs without any biotransformation. On a simpler note, this gas has a minimal alveolar concentration of 105%, which means at no level, at no point, it can really make you unconscious. If that's what we are looking at the takeaway message, even if we want to give it, it cannot. But the key word is nitrous oxide and oxygen together, not separate. So alone nitrous oxide has some potency, but nitrous oxide oxygen, which is in the ratio of 70 to 30, can never cause forget about the morbidity or mortality on the form of any untoward event. You can't even get unconscious from that. So that is very important for you, for everyone here to be understanding it. The second gas effect is very important. If some of us have worked in OTs, they know that nitrous oxide is used as an induction agent so that the other gas which is being used can quickly get affected because it allows the rapid uptake of the other gas. But again, not very relevant for us to remember. What we need to know is it's a very safe gas, it's non-allergenic, it's least toxic, basically safer than a paracetamol or a combiflam, if you have to say it to your patients or to yourself. A quick update. Am I going fast? Am I going slow? Am I going okay? Can quickly somebody let me know. Is it okay? Can somebody give me a thumbs up or just put it on the chat?
You're okay. You're okay, sir.
Thank you. Thank you. So the first letters we want to learn for nitrous oxide is the A. A means everything in the form of analgesia. Although we have to remember the analgesia or the pain lessening part is very limited. We will talk about this a little later, but the highlight is that ऐसा नहीं है कि हमने gas use कर ली तो उसको pain नहीं होगा. It is not a substitute for pain relief anesthesia, the local anesthesia, but it has some analgesic effect in the form of some light drilling you were doing or some minimal work that definitely you can do, or it can reduce the effect of pain but doesn't eliminate the pain. Anxiolysis 100%. In the form of reducing the anxiety or apprehension, some form of amnesia. When a person would be under the gas, they would know कि वो बैठे हैं, वो gas जा रही है, वो treatment हो रहा है, but they would not remember कितना लंबा हुआ या कितने teeth हुए. They would not remember exact details. The administration part is extremely easy. I always say it is easier than giving an LA, probably easier than anything in dentistry in the form of administration, and acceptability is as simple as like a nebulizer, like just putting the mask. So those letters are important to remember. We'll also talk about a few of the properties like titration and rapid recovery. So see, as we mentioned, onset of action, the moment we put the mask, nasal mask or nasal hood, the effect starts within a minute, but the peak effect we will get to know within 5 to 10 minutes. But you start that basic sensation of tingling, lightness, euphoria, feeling good, अच्छा लग रहा है, मजा आ रहा है, मैं उड़ रहा हूँ. All those things starts within 5 to 7 minutes. Again, there might be some variability depending on person to person, but yes, I have seen people flying within 5 to 7 minutes. Now, titration is something which is very important to talk about. Any drug you give in dentistry or in medicine in the form of a Combiflam, a painkiller, an antibiotic, any antifungal, any medication, orally, IM or IV, you really can't titrate. Like you can do more dose, but you can't reduce it. Nitrous oxide oxygen inhalation sedation, we will use the term noise from here on, is the only thing, only way which is titrable. Like at any point, I can increase and I can decrease depending on the response I'm looking at. So that's where it is very, very differentiable, very, very safe, and very, very comfortable. At any point, if I feel I have to stop, I can stop it immediately, and the person would come back to the normal level again within 5 to 7 minutes. So the recovery and onset of action is same. Remember the word Maggie noodles. 5 minutes mein start and 5 minutes mein done. So it is very, very important takeaway messages who are listening, that we don't have to worry about recovery room and all those stuff. The patient can really walk away from the chair specifically. Some may feel a little lightheadedness or little bit disorientation, but that's very rare. Most of the people can talk, laugh, and feel good about what has been done just now. So that's important to highlight it. Again, these are excerpts from the book called Maurice Clark. I'll share at the end, where everything is mentioned in detail. Now, in children dentistry or pediatric dentistry, it is indicated in every possible way, right? If you remember the FR4 rating, FR4, FR3, FR2, in the form of anybody who has mild to moderate anxiety. Now we even can put in a child who's extremely phobic. We do mix nitrous. So that's a little higher level of sedation dentistry, where under restraint, we put the mask, and within 10 to 15 minutes, because the child is crying and not able to accept the mask, the effect happens slowly, but the effect happened. But in general, it is indicated in all the categories of children, even in the children who are FR4. When I say FR4, even in a child or an adult who's extremely fine, to make sure that they don't get upset, they don't get negative, they don't get fearful. So it's an amazing behavior management, behavior shaping tool. Now, it is extremely safe in any cardiovascular disease, any neurological disease. अगर आपको heart fail है, kidney fail है, liver fail है, it works amazingly well. अगर आपको asthma है, it is absolutely safe. It is amazing tool for children who gag, especially during impression making, although we have scans now, because it reduces the gag reflex. It can be an amazing adjunct or an alternate to higher pharmacological things like oral sedation or a GA. If I use this gas every day in special needs, even children with cerebral palsy, in Down syndrome, in kidney, most of the places where other drugs are not indicated, this is absolutely safe. So it is an amazing, amazing tool. Once you have it, you know it, how to use it. Very important highlight, probably the people who are not pediatric dentists can click this. It is a misconception that it is to be done, used only for children dentistry. It is amazingly used in everything else. I'm sure in your practices, you have adults and elderlies and older people, or maybe young adults who are anxious, who are apprehensive, वो सामने से बोलते कि बस आप जल्दी से कर दो, या मुझे इंजेक्शन से डर लगता है, या मुझे नहीं बैठना, या मुझे बेहोश करके कर दो. Either Gurkir sir is there. I'm sure he deals with a lot of orthodontic procedures where the kids are not helpful for the simplicity of the procedure. Restoration, periodontal implants, hygienes, bridges, prosthodontic surgery, anything and everything in dentistry can be covered under nitrous sedation. So don't have that thought process that it's only for children and it is only for somebody when somebody is crying. No, it doesn't work that way. You don't use LA only for when somebody is crying of pain. You use it in every single case. That's how it works. So are there no contraindication at all, or you can use it in every possible way? Not exactly. There are certain things. So You may use in all those situations which are very medically complex, but you may not be able to use this in when you have an earache, eye pain, or stomach ache, or a cold cough and congestion, because since this is a gas, it really plays with the interstitial gases in your body. So certain conditions are obviously, if you have a COPD, a pneumothorax or cystic fibrosis, there is a known challenges in the form of it interferes with uh, the vitamin B12 absorption, and in the form of pernicious anemia and bone marrow. So first trimester pregnancy, it is advised to be avoided. If somebody is going through a certain medication in the form of bleomycin sulfate, somebody who can't really follow and consent for this, certain other drugs. But again, these are all very rare situations. You may not find this regularly in your clinic. Relatively, as I mentioned, what regularly you need to be sure is if somebody is saying stomach ache hai, या earache चल रहा है, या फिर some surgery has happened recently in any of the cavities, avoid it. If you have a cold and cough, it just won't work. So the child won't be able to breathe, and if they are not able to breathe, it just doesn't work. So those are the things which you have to remember. But by and large, you can use it in every possible way. So I can touch base on what are the components of sedation, although it is again a very elaborate topic. But you have some tubings, you have some pressure gauges, some flow meters, there's a regulator. I think I've got a fantastic video which probably can cover this in quickly 2-3 minutes. So I'll be happy to show that video, which shows that how the flow meter, which is basically the heart of the machine, mixes the gases together, and through a bag tree, or we call as reservoir bag, the gas comes through this coaxial tubing, which is the fresh gas. Now, this is a coaxial tubing where the outer layer has the gas which is to be inhaled, and the inner layer is the gas which is exhaled. This is through a happening called double mask. And then it goes back through this vacuum suction. Again, this is active suction. Our passive suction, we'll touch base on scavenging part, doesn't really work. You need an active suctioning, active vacuum at 45 liters per minute, and puts out the gas outlet. So let's try to see this through a video. It's important to know that all these machines are designed to be used by us. If I'm sure this thing would always be there in the mind, probably attending the session, and in general, that these machines are designed to be used by dentists, not by anesthetist. Anesthetists used Boyle's apparatus or the new workstations, but those have multiple ways to do multiple drugs. This machine is used to be only by dentist, and it can only provide nitrous oxide. Apart from that, it has certain safety features like pin index safety system, diameter index safety system, color codings, minimum oxygen 30%. So our environment has 21% oxygen. At every point, this gas will provide 30% oxygen. And in case there is no oxygen, the nitrous would not be there. There's always an emergency air inlet so that you can provide the environmental air and their alarm and outage. So we'll come through this. I think there's one video which probably, yeah, I have that video. But before that, to quickly highlight the safety features, when I talked about the pin index safety system, it simply says the nitrous cylinder, which is in blue color, and the oxygen cylinder, which is in green color. They cannot fit in each other's yoke assembly, because the way, if you see the configuration of the pins. So even if somebody wants to manipulate or maneuver or probably try to have some damage, it won't work. So do remember that it is very safe. Similarly, the tubings of each of the gases cannot be interchanged. That is what we call as the diameter index safety system, or DIS. So the diameters are different. So by accident also, you can't kill someone, if that's the takeaway message we want to have. I think this video should clarify a lot of stuff. Let's have a look at this video.
This is the on and off button. This is the pressure reducing valve.
So pressure reducing valve is basically the regulators, which basically reduces the pressure coming from the jumbo cylinders or the big cylinders, or from the regular portable cylinders to the machine.
This is the pressure reducing valve. This is the yoke. These are the pin index. This is the flow meter. This is the oxygen flash button. This is the reservoir bag. This is called conducting tube. This section called anatomical dead space. This is the scavenging system. Both nitrous and oxygen gas come in and go through the nasal hood. Then the exhaled gas is sectioned by a small tube which is attached to a slow suction. The scavenging system connects to high-speed suction. Then airflow is adjusted by the knobs. Make sure a black ball stays in the middle of the green section. This is how to connect the nasal hood to the hoses. The bigger hole goes to the bigger tube. The smaller hole goes to the smaller tube. Nasal hood is 2 layers. Inner mask must be placed correctly.
So this highlights that how the reservoir bag is used. Actually, this video is covering a lot of aspect, but just to quickly highlight, whenever we prepare the machine, the reservoir bag is an indicator of the tidal volume. Now, there is a complex way of calculating the tidal volume, but it's not possible to do it in the child or an adult regularly. So simply, the bag should be inflated. For an adult, it should be an adult reservoir bag, which is around 5 to 7 liter. For the child, it has to be 3 to 5 liter, if I'm correct. This bag has to be 2/3 inflated. So if it's overinflated, it means the more gas is coming and the person is taking less gas. And if it is underinflated or it is collapsed, it means more demand is there and the less gas is coming. So the 2/3 is the key to remember. Now, what is mentioned, what is shown over here is called slow induction or slow titration, where we are increasing the concentration only 1 liter per minute. Now, in usual clinical practices, it is not possible or not really required because we really want the person to have that hit and high that the gas is working. There's another technique called rapid induction where we directly go to the level of 30 to 50%, which is the bracket of the range. Remember, 30% is minimal percentage we are looking for having some effect. 70 is the maximum we can give. 50 is the most optimal percentage. So when I say 50%, I mean 50% nitrous oxide, 50% oxygen. You can't give more than 70%. The machine doesn't allow. Anything less than 30 doesn't really have that effect. 50 is the optimal one. And in the rapid way, we directly go to the 50 and then in case want to maintain there, or can come back to 40 if we feel the person is getting over sedated or adequate sedation is already done.
sedated. Dr. Dental.
Yeah, so the bottom line, which I want, I think we have 20 of them, us over here right now, is a very, very important message because in India, the nitrous oxide sedation has gone through a tough battle. For a long period of time, there was a lot of misinformation, misguidance, miscommunication, even from the regulatory authorities there. But it's very important to remember the bottom line that never ever, and I'm going to read it out so that it's taken in the best possible way. There never has been a reported death caused by nitrous oxide oxygen inhalation sedation in a dental office while dentists perform the dental procedures with nitrous oxide oxygen as a sole sedative administered by the means of an appropriately installed and maintained delivery system. Now, why the yellow highlight is there? Because if you're using a cocktail, including like nitrous oxide, oxygen, and something else too, then the equation changes. Like I suppose use ketamine or propofol or midazolam, then the things remain different. Also, it has to be done appropriately. You cannot have shortcomings in the installation system, and it should be maintained well. And this is what you need to remember at every point of time whenever you are thinking about having the gas, probably the takeaway of the session, or using it, that it doesn't cause. So when in the first couple of years of my practice, when I used to have children getting non-interactive or sleeping during sedation, I used to feel a little jittery, oh, something is not happening. Is the child okay? But now I am absolutely fine. I know it. The child can sleep, but cannot get unconscious. So it's absolutely safe in every possible way. Now, there are again certain technicalities of how to prepare it. Again, it's an elaborate topic in the form of using SOAP-Me, which is suction, oxygen, airway, pharmacy monitor equipment. The purpose of this session is to give you a little glimpse about how does it work. But I would strongly suggest to go through reading about this. It's very important to read about sedation because, again, since you're going to be a sedationist, apart from being a dentist, it's important to know what is a Yanker type suction, what is oxygen supply. It's important to have a BLS training. It's important to read any course, any session like this, any workshop can motivate you, guide you, give you some tips and tricks and show you. But it's important to read and then practice and then keep learning and keep practicing. That's the way how we have been doing pediatric dentistry, adult dentistry, or dentistry in general. So you need to have emergency medication. You need to have some form of monitoring. For nitrous oxide oxygen, let me put it on the record. As of currently, I'm not using any monitoring, but yes, we can have pulse oximeter. The ideal thing is to use a multi-parameter monitor. But again, it's not essential because it's very, very safe. But the more you have monitors with you, it's good. ET-CO2 or end-tidal CO2 is much better. But again, in routine practice, a pulse oximeter is more than enough. And I think everybody knows how to use it after the COVID times. Okay, so continuing this, we have some consent form. Again, if somebody wants, they can reach out to me. I can share with us how the sedation protocol happens in our practices in the form of sedation record. I run an exclusive children dental practice, and I don't. I have a paperless clinic in the form of I do e-health records. The only records we have is for the sedation because medical legally I need to maintain that. So that I do it. These are again some basic records of NPO maintained, previous sedation, equipment check, and how the person is behaving during the sedation. So I can share with you, it's given in certain books. Again, it's not rocket science. Once you make up your mind to practice sedation, practice nitrous oxide, buy the machine, all these things can happen without any major issues. I think we talked about this, the whole technique through the video. Now, what I would like to show in the next, I think we have hardly 10-15 minutes left, certain videos which we do it in our practice and which probably can motivate you how to use it. in a happy way. So that's how we introduce the mask to the child to breathe nicely. And if you can see it closely, you see the double scavenging mask. Whenever child is inhaling, the mask is getting sucked in, and whenever it is exhaling, it is getting going out. So we jokingly say in our practice to the parent that sometimes it feels that children are drunken, but that's how they behave once the gas effect kicks in. It's good to use the sign language in the during the sedation, because we don't want children to speak. Because of speaking, sometimes the effect goes down. So it's good to keep using the sign language. As I mentioned, we use these gases even for the children who are fairly happy high, fairly good, but just to give them the experience where there's no negativity and overall happy experiences. The girl in the bottom left is actually doing her Bharatanatyam moves after getting the LA shot. So that's how it changes the perception. Yeah, so this is how we enjoy our practice. It's not easy to deal with the kids. We always say that, but with the sedation, the life becomes a little easier. A little video about how the gas can be used in the first visit itself to make it a happy experience. It's an important thing to see that in this video, the parents are not in the picture. Parents are being actually counseled in our other room, which is jungle room. In the aqua room, the children are sitting nicely, the siblings, and see how the gas is making the children comfortable, watching TV, using the headphone, and even doing some basic procedures to instill a positive attitude, and using minimally invasive technique like SDF, trying to keep the children dentistry simpler and effective. We talked about the gag part. So we talked about the children who are, so we have talked about till now the FR4 children, or the children who are already happy or comfortable, or the children who are coming for the first time. So let's see a video where the child already has a negative experience. The child is distrusting, apprehensive, doesn't want to even come. So here you have to use your behavior. Remember, nitrous oxide is not a substitute for your basic behavior management. So you still talk to them, instill some confidence, bring them to the chair, but then don't do the treatment or don't do the checkup. In our practice, we don't even touch the child. We don't even wear the gloves unless until child sits on the chair, accepts the mask. The moment they accept the mask, it really settles them down, calms them down. And once then that is happening, then we do the telcho, do the modeling, do the desensitization. So gas, nitrous oxide noise helps in calming the child. Rest, you still do what you need to do. But once they trust you, the outcome becomes amazingly different. Now, under one, this is a video of my colleague from Pune. This is a combined content where a nitrous oxide along with rubber dam really helps in doing coordinate dentistry in the most still way. So you won't believe that this is a child, this is done on a rubber dam under nitrous oxide, and we are finishing in one go 3 to 4 teeth with absolute stillness. So we use a word called from squirming to stilling. The child sits nicely, and we are able to finish multiple work in one go. So it really, really increases the efficiency of doing more treatment under the gas. So sometimes the children are FR1 in the form we discussed, the children are ready to enter, or probably are too anxious, too fearful, or pre-cooperative or limited ability to cooperate. Now you can see in this video, the child is not willing to enter. She's asking parents to come out. I don't want to go, or I'll be only sitting in the lab. Now, when we have situation, we talk to the parents, although our current systems highlight to prepare the parents beforehand, but sometimes parents don't read the links or don't understand about the gas. So here we told them, other than pushing the child unnecessarily, let her prepare again next time. So then she came back again. This time parents knew about the gas. Parents were prepared the child. We also give the mask to them at home. And she also talked to the other child who just got the dental treatment done. And then we brought the child inside. This time also she is stubborn not to sit. But then you have to be very patient. And very slowly and gently, eventually child accepts to sit on the chair. And then also we start with, this is a COVID video. And then also we start only with the gas. The moment the gas happens, everything else is taken care. And the child's, what we call is the meltdown stops. And we do what we need to do. So this is an amazing tool to begin with. As we mentioned about the gagging part, in certain children who are gagging, or adults for that matter, they have a lot of gagging and can't really take the instrument inside. The gas calms them and allow us to do a lot of treatment without feeling that gag. I'm sorry, I'm trying to just rush through a little video because we have a lot of them left and the time is pressing. In certain cases, the gas would not work. So we have to remember, eventually, although we are talking about nitrous sedation, but eventually when you practice sedation, you have to practice a bunch of techniques. So in certain cases, apart from nitrous, we have to use oral medication. In this case, you see the child is given the oral medication. I'm not going into the details of which medication, oral midazolam, because again, it's not the topic of interest for today's lecture. But even after the sedation, even after the medication, we still use the gas as an adjunct, as an augment, because the child was still resistant and reluctant to sit. So then we use the gas and some restraint, but then eventually she allowed the examination, taking pictures, the using minimally invasive approaches. And then most importantly, so once the sedation effect happens, the child cries a little bit, but once the child goes out, they don't come in a negative way. So this is important. And it's at the end, if it's not ending in tears, it's a good visit. Now, I'm also a special needs pediatric dentist, so I deal a lot of children with special needs. And we use this gas even for the special needs. Sometimes we have to use under restraint, so they're not accepting it. But then they allow us to at least examine the child, perform some minimally invasive procedures. We take pictures and radiograph for every case. Here also, if you see that parents are trying, but the child is not able to cope. Here we use the gas. They cry initially, but then we do some restraint, put the audiovisual aids, give some time. Eventually, the gas takes the effect, and then the child gets comfortable. we try to use minimally invasive procedure in the first visit so that the child goes on a happy note. Remember, these are different strategies for a pediatric dentist to make sure that eventually the child goes with a happy experience, even if when it started, it was unpleasant. But it's a fantastic success story. It's a little longer video. I'll try to just skip through it a bit, where again, we use different agents to make the family comfortable. The first visit was only making it using the. So first visit was only checkup, and then second visit, we use some medication in the form of oral medication and the gas. So here again, we use a combination of the laughing gas and oral medication and did minimally invasive procedure. But unfortunately, the child also required general anesthesia because there were a lot of work which couldn't have been done without using GA. The good thing to know is that this child has been under follow-up for the last 5 years, 4 years now, 4.5 years. And we have a successful follow-up of 7 months, 14 months, 24 months, almost 2 years. The permanent molars have come, the sealants have come, and everything is stable. And it's been 30, almost 2.5, 3 years. I think again, I have another 6 months radio gaps now. And the child has grown to a big boy and has been a very happy and comfortable journey. So a quick takeaway message that a child, or in this session, I can say any adult's behavioral resistance without any aids will always be challenging. So try to use a help in the form of sedation. The resistance will always go away and it will be a happy journey for everyone. I always use a slide to say that it's basically a saliva. Anything and everything in form of challenges. The way you use local anesthesia for pain, anxiety के लिए हो गया नहीं चलेगा. It's better to use something which really calms and give a happy experience to your patients. So, Dr. Sudhir, I think it's 6:30. I have another 5-7 minutes of. So we have covered about the why the gas is required, but I think everybody would be happy to know from where to buy and what to buy. So if you can give me 5-10 minutes more, I can cover quickly that part also.
Sure. Go ahead, sir.
Yeah. So again, this is a very small glimpse of my bigger session, which is available on PedoZen. Some of you probably might be aware. But again, a gist of what to buy. So there are a couple of international brands available in India. It's mentioned in the slide. Although this is a non-sponsored lecture, but I'm going to talk about something which is recently made in India and something which is much more digital than the existing ones. So Porter has been there for a long time. It's from the US. Accuton is not available in India, although I have the machine because of some connections, but it's not available. Baldus from Germany now is available on dental card. So if somebody wants to buy it through a portal, they can buy it. We have some fantastic Indian brands also in the form of Concert, SmartSed, and Knox. Again, one has to do some research and talk to the company to see what works best. They have different price ranges depending on are they imported or are they being made in India or assembled in India. My suggestion to do your homework before you buy one and try to invest in a good machine because it's going to be a workhorse, just like the way you do it for your dental chair or for your scanners or for anything else. I'm going to talk a little bit about something called a well-said machine from Medixa. This is majorly talked because I'm one of the principal consultant for this machine. What we talked about the digital part is it has an entire touch screen, which is probably the first time made in India with different sedation modes. And it has a lot of features apart from the original features to make it a very safe machine. So I think the video will cover that part. So I'll be happy to play the video.
Hey, Dixa Global LLP proudly present Well Said, a fully digital sedation machine that represents the pinnacle of our innovation and dedication to excellence in healthcare. Well Said is a testament to our commitment to this mission, offering state-of-the-art features that set new standards in patient care and safety. Our team of skilled engineers and quality control experts work tirelessly to guarantee that every Well Said machine meets rigorous safety and performance criteria. Introducing Well Said, a fully digital sedation machine designed for modern dental practices. Well Said offers a 10.1-inch capacitive touch display, providing a user-friendly interface for easy operation. The digital hypoxia guard ensures patient safety by stopping N2O flow immediately in event of oxygen failure. Real-time monitoring of gas supplies allows for precise sedation management. Well Said's advanced features include flow graphs of both gases, multiple sedation modes, such as sedation, titration, and recovery, and comprehensive acoustic and visual alarms. With 45 days of patient log history and user defaults for both adults and children, Well Said's designed to make sedation management seamless and effective. Additionally, it provides crucial information like the remaining time for cylinder gases and sedation timers, making it an indispensable tool in any dental practice. For more information, visit our website or contact us today. Well Said by Medixa Global LLP, redefining sedation digitally.
So we've been part of this journey for the last 6 to 8 months now. The machine is already launched. We have done the training. This machine is very well there in our practice. If anybody wants to see the prototype, how does it work, feel free to visit the practice. I'll be happy to show it around. We have already done some trainings with our colleagues. These are pediatric dentists from all over the world, all over the country. And this was launched last year in July in Dubai, and we already have started using the glass. Remember, everything else remains same, but the analog becomes digital. The touchscreen becomes much easier to use. It's easy for the staff, it's easy for us. And the logs, the records, the safety, the visual part, it's so amazing to see the graph, how the gas is coming. So we don't assume if the gas is working well or not. We can see it visually, how the gas is being administered. Yeah, so all these videos are available on our YouTube channel. Feel free to go through it on our social media in the form of Instagram, YouTube, and LinkedIn. So we already have covered some. So we were there in IDA UP State Conference and talked about this. The awards and recognitions are already there for this machine. And this is just to highlight that this is something one can consider if you are planning to start sedation in your practice. With this, I think I'm just gonna take last 2 minutes to share my journey. This is for almost 11 years younger me in South Korea, where I had first exposure of how a digital sedation practice should be. So learned a lot, got inspired, seeing somebody doing a sealant under a rubber dam under nitrous oxide. That really inspired me to do what I'm doing right now. And that's thanks to my mentor, Dr. Lee. Recently, we won award in Hyderabad under his name only for the tribute part. I also owe a lot of my success to my fellowship from Sick Kids Hospital, Toronto. I am probably the first Indian pediatric dentist to do that. Feel very humbled, honored, and gratified to do the same. That has been a really high for my professional journey. And I've done hundreds of cases over there during my fellowship program. But what I've been doing in our practice for the last 8 years is something which again taught me a lot. So I'm part of different organizations working with special needs, working with different groups. I'm a myofunction specialist, mouth breathing specialist. So it's been a fantastic journey. It's always good to share and learn from everyone. So thank you so much for patient hearing. I think I probably take 5 minutes extra. This is a little brief about me. You can click a picture, take a screenshot. I think most of you probably know us on Instagram, YouTube, Facebook, LinkedIn. So feel free to contact us anytime you want to visit to see the practice, to see the sedation. How does it perform? Feel free. And we also have a platform called PedoZen to do some online training. Feel free to visit the website. You'll get all the details over there. Over to Dr. Sudhir. Do we do the quiz first or do we do the FAQs first?
Anything is fine. We generally do it in chat. So audience will decide. They want to answer by audio or chat. Both are fine. You can ask the questions. It is very interesting part actually for all the doctors here. Very interesting. Always it is very interesting.
Thank you so much. I would be happy since we are only 14 of us. I would be happy if somebody wants to come on the video.
Please switch on your videos. Request you to switch on your videos.
Any
all
queries,
of the doctors here, and let's start the quiz. It is very interesting part.
Thank you. Any queries? Any comments?
You can ask queries also, as well as there is a message from Gurkirat sir. Only thing that keeps us away from this is lack of knowledge about it. Very informative lecture. Thanks. It is very well said that difficult topic, very difficult to take ahead. Abhishek Soni is also doing along with you. Many pediatricians are there, and you are one of them. Congratulations, Dr. Sanchit, for this. First of all, you are doing awesome work and fantastic presentation.
Thank you so much. Thank you.
Somebody has requested for provide a book to read. You mentioned of the book, na?
So there's a book by Malamud. We all have read Malamud for local anesthesia. There's a Malamud book for sedation. I think it's not in my slides. Usually I provide it in my other lectures, but that's for entire sedation. That's comprehensive. But if you really want to read particular for nitrous oxide, Maurice Clark is
Maurice Clark. Please share the link if possible.
I think so since it's an international author book, if I can't share the pirated copies, it's important to buy it. But yes, that something can really give you foundation. But I would also suggest we also have a book from Dr. Kunal Gupta, our very own pediatric dentist over there. His book is also very Indianized. So either of the book would really help. You can attend as many sessions as you want. As we know, the more we talk about it, the more we read about it, it would help. No one session, no one lecture, no one course would make you a master of it. So the more you keep doing it, the better it is. And it's best to actually observe. That's why I'm saying whoever is there, feel free to visit. It's important to see it. That's why we try to show the videos. That would really motivate you. Just by reading, it won't help also.
Fine. Can we go for the quiz then?
Yeah, please.
Prizes are there. Take part.
Yeah.
All the best. Yeah. Yes, sir. First question.
Okay. So I thought to make it a little tricky, but I don't know. So I just wanted to make the quiz that if somebody is listening it carefully, they can probably answer it. So I shown an advertisement where which year there was an ad where the dentist said, okay, I use nitrous oxide, oxygen sedation. Can anybody mention the year? And if not the exact year, probably the decade. I'm okay with the decade also. Anyone?
Sakshi has answered 1845 in chat box.
Okay. So 1845 was the one where they demonstrated the procedure, but not the ad. But again, glad you actually remembered one year. Okay. Anybody else want to try?
2 attempts are there. 3 attempts are there.
Okay, I don't know the rules. I'm sure you can take care of the rules.
No, the thing is to attend the webinar attentively, to learn it attentively.
Yes.
And apply it in the practice and earn more and earn fame and name also. That is the motive behind this quiz,
Yeah,
actually, sir.
100%. So
Because
I'll be
you are
happy
taking
to.
so many efforts to present, so
Yeah.
the attention should be there,
Yeah.
each and everyone. That is why I have kept this.
No, it's very important.
Yeah.
It's very important. Some international sessions actually have a post survey and a post quiz just for the same reason. So do you want me to give the answer over here now?
Another answer she gave, June 30, 1882.
Okay. And so I'm hoping she didn't Google search or something. But yeah, that's probably the correct answer. That's
Okay.
absolutely correct. And she actually mentioned the exact date.
Fine.
So glad. So
Can we
fantastic.
go next question? Yes, sir.
Yeah. So the takeaway message is, remember, it is happening for 140 years now. So it's that.
Yeah, long
And
back.
I think this is a very simple one I just mentioned. What's the name of the new digital sedation machine? If somebody remembered taking a screenshot or probably remember the.
I have all screenshots. I know the answer, but I'm not allowed to answer it.
See, people can always
I
find
know
ways to
the
answer.
answer. Previous answer I was not knowing. I was
Okay.
not knowing the previous answer. Somebody has answered Porter.
So
P-O-R.
Porter is so Porter also has digital machine. But I'm
Nikita
talking about.
Johri answered, well said.
Yeah. So Dr. Nikita probably knows better. She is the associate at my practice for now. So I'm
Okay.
sure she knows it well. So
Fine.
that's well said for sure. Now, just
Okay.
to give you a perspective, it is the word mentions well is coming from Horace Wells, and
Okay.
said is obviously sedation, and also it is
Okay.
meaning it is well said. So that's the perspective of the machine. Yeah. So that's the answer. That's it. So I just prepared two for
So
now.
only two questions. Fine.
Yeah.
Two winners are there. Dr. Sakshi is first and Dr. Nikita is also first. Both are the first winners. We will send the prizes and certificates. Or if they don't want certificate, anyone wants certificate for the participation of the course, you can ask me in private. We will send you, and prizes will be sent to the winners. You have to post a video. It is from Trendy Brandy, Dr. Salim Vora,
Yeah.
sponsored by Dr. Salim Vora. Trendy Brandy. You have to send a video after that, receiving the prize. And thank you once again. Thank you, sir. Thank you, Dr. Sanchit Paul, for
Always.
accepting the invitation, coming here, taking efforts, bringing awareness all over India, and taking so many efforts for pediatric practice, as well as this. You are taking efforts for multiple approaches. One of the approach is nitrous oxide, which is digital happy gas. So once again, thank you and congratulations to you.
Thank you to you, and kudos to you to run this marathon. It's a new year 2025. I hope I'm going to take another session till 2027 for 10 years.
No. Till one more will be there. 27, one more will be there. Not like this year.
Okay. No, but fantastic. And let's keep it going. Thank you to everyone.
Okay.
Have a good night.
Have a
Bye-bye.
good night.